job is pretty easy today. You're doing just the short introduction.
I like it.
Yep. And Mark Kroger will be right here. I'm going to put him right here. So when you get to your...
to introduce our panelists, please welcome Mark.
And I put a little mention of September 11th, just a little
I loved that. I've noticed that.
Yeah.
Thank you.
Yeah.
That was really meaningful.
That's good.
Yeah.
And when you're done and you turn the podium over to Mark, you should be finished because Kristen is going to
close us out.
Yeah.
Perfect. Great.
So
Good.
Easy peasy lemon squeezy. All right.
Thank you so much.
We're about ready. I'll cue you in just a moment.
You know there's going to be a couple of intros. I'll just kick it off and you'll have a couple. Good afternoon. Good afternoon, everyone. Welcome to the Columbus Metropolitan Club. As many of you know, CMC connects people and ideas through community conversations every week, just like this one today. Today is an important day in American history for more than one reason, but especially to remember the lives lost 23 years ago today. Bringing people together for civil conversations like our forum today has never been more important than now, and we are grateful for all of you for joining us. I'm Kristen Easterday. I'm Director of Communications and Government Affairs at the Columbus Regional Airport Authority, but I also have the pleasure of serving on the CMC Board of Trustees. Thank you to our organizations that helped make today's community conversation possible. The Jeffrey Family Legacy Fund, which helps CMC to promote a thriving, equitable, and sustainable community. Kroger, Nationwide, and the Osteopathic Heritage Foundation. We would also like to thank today's forum partner, the Ellis, and our presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation. Lastly, thank you to our live stream partner, the Columbus Dispatch. Every CMC forum takes a village, and I want to thank everyone for their support today. Thank you. So to today's topic, what would it take to end hunger in Central Ohio? Well, according to Hunger Ohio, our state has one of the highest rates of food insecurity in the country, with over 400,000 children across the state living in food insecure households. So what would it take to end hunger once and for all here in Central Ohio? Well, to help answer this question and to mark Hunger Action Month, we're honored today to bring together a panel of passionate experts to spotlight hunger in our midst and the actionable steps that we can all take together. To introduce our panelists, please welcome Mark Bruce on behalf of our sponsor today, Kroger. Mark, the podium is yours.
Good afternoon, everyone. Thank you very much, Kristen. Thank you to the Columbus Metropolitan Club for hosting us all today. So this topic, we had to be involved at Kroger because this goes straight to the heart of everything we do. Our purpose is to feed the human spirit. And that's really not just a slogan when I talk about our associates. We carry that purpose out every day in our communities through our Zero Hunger, Zero Waste mission. That's how we work to achieve the very question that is being asked today: how do we end hunger in Central Ohio? In 2023, Kroger donated more than $3.5 million locally toward ending hunger. We rescued another 2 million pounds of food from our stores and donated just to Central Ohio area food banks and hunger-ending organizations. We want to help. Thank you. We're doing what we can to help answer this question and end this problem. We're a proud Ohio company, founded here more than 100 years ago. Each of our 49,000 Ohio associates work every day to end hunger, but we're really grateful for those organizations that do the hard work. The food pantries. I see some food pantry friends out here today that rescue the food from our stores and get it to people's plates. Those social service organizations that help individuals in crisis get what they need, which often starts with food. That's the first way out of crisis, making sure someone has a full belly. And the experts that can research, track, procure, and then store the food that can help fill those hungry needs. So we hear it all the time, the Columbus way, right? Collaborative, innovative, inclusive, maybe a little bold, not typically Midwestern, but that's okay. We don't have to always be Midwestern. That's how big things get done, is to work the Columbus way. So let's follow the Columbus way, listen to these experts today, and work together toward a future where a country that produces enough food to feed every single citizen actually makes sure every single citizen doesn't go to bed hungry, right? That's what we want to do today. So on behalf of Kroger, I want to welcome today's panelists. First, Dr. Carol Bradford, Dean of the Ohio State University School of Medicine, Vice President of Health Sciences at the Ohio State University Wexner Medical Center, and a fellow board member of mine at the Mid-Ohio Food Collective. Dr. Bradford, thanks for being here. Matt Habash, President and CEO of the Mid-Ohio Food Collective. Don't ask him how many years, because he doesn't want to answer that question. Dr. Maishika Roberts, Health Commissioner for Columbus Public Health. Adam Troy, Executive Director of the Community of Caring Development Foundation. And our host is Michelle Brown, President and CEO of the Children's Hunger Alliance. Michelle, welcome to CMC. The podium's yours.
Thank you, Mark, and it's wonderful to see all of you here today. I want to echo Kristen's remembrance of those lives we lost, the 2,997 lives we lost on 9/11, all of the veterans and first responders who are commemorating that day alongside of us in our community. I also want to remind us of what we learned, which was that there's no active service that's too small to make a difference, and want to invite that spirit of unity that I know we have, which leads us into today's topic. As you know, addressing hunger requires many people working together with shared goals and vision, in part because of how we determine who needs help and how many hoops they're going to have to jump through to get it. Many people are left to decide between food or medicine and a host of other necessities. In fact, 64% of the people who are food insecure do not qualify for SNAP, Supplemental Nutrition Assistance Program benefits, because they make more than the limit, the federal limit of 130%. For a family of four, that's $40,000. So if you all imagine trying to feed a family of four on $40,000. For children in Franklin County, food insecurity rates rise from 17 to 22.5% between 2021 and 2022. And at CHA, where I work, we're getting food to kids right where they are, making sure that kids across Ohio and 76 counties have food to eat every day. Our esteemed panelists today work creatively and strategically to address food security, racial equity, and health. And we're going to dig into what it would look like to eliminate food insecurity across Central Ohio. So to start us off, I'd love to hear from each of you going down the line. Why does this issue matter to you, and how does the current lack of nutritious food affect our community?
I'm super excited to be here, so thank you all for the gracious invitation. And so, again, I wear a couple of hats. One is the Dean of the College of Medicine at The Ohio State University, and I've learned so much as a board member on our amazing Mid-Ohio Food Collective. And so I think my perspective on this is absolutely we need to provide every Ohioan and every member of our community access to healthy, nutritious meals every single day. And the reason we need to do that is because that is how we create healthy communities. That's how we create healthy lifestyles. That's how we prevent chronic illness and disease. I think we all understand that lack of access to healthy meals creates, from food insecurity and other factors, creates higher rates of heart disease, cancer, and obesity, and all of that really impacts how individuals in our community can contribute. So I'm super interested. I joined the Mid-Ohio Food Collective because I really felt, as the Dean of the College of Medicine, I needed to be part of the solution to serving the community and creating and transforming giving everybody a chance to thrive and to have a healthy life.
Thank you, Dr. Bradford. I will tell you, I've been here 40 years. That's started when I was 2 years old. And I can tell you there's a couple of partnerships that actually outdate me. My partnership with Kroger at the Ohio Food Collective and our partnership with Nationwide are actually been existing before I even got to the food bank, which has been open since 1980 and has now evolved into the collective. And I'll talk a little bit more about that later. But for me, this work, when I took the job, if you find the original Dispatch article in 1984, I said my dream was to go out of business, that we would not need food banks anymore. Here we are, 40 years later, and it's worse than it's ever been. It's 30% higher in the number of people we're helping than it was at the peak of COVID, and I didn't think that was possible. So it's a huge challenge, and frankly, most of the issue of ending hunger has nothing to do with food. At the end of the day, it's resources to pay the bills, and the last thing that's most variable in your budget is food. So if we can solve for the bigger crises that we have around all of the other issues that people are facing in today's world, we won't have food security. I tell people all the time, food security has nothing to do with food. It has to do with your ability to afford the food because you're paying all the other bills. And we've got to solve for those issues, and we've got to take a very long-term approach to that.
Well, good afternoon, and thanks again for having me on this panel. At Columbus Public Health, my colleagues and I work hard every day to protect health and improve lives. And I firmly believe that food is health. And so if you don't have access to food, along with the other social determinants of health, like housing, transportation, income, a job to pay for that food, you cannot be healthy and you cannot realize your full potential. So we not only want individuals to have access to food, but as has been said already, healthy food. And so that includes protein, that includes vegetables, that includes some healthy carbs and reducing the sugar. And we know that if you've gone to the grocery store lately, sometimes eating healthy is not financially affordable for many people. And so we work hard along with the Mid-Ohio Food Collective, along with the Franklin County local food plan to try to make food, a healthy food, accessible to all, because we know that you cannot be healthy if you do not have access to a well-rounded diet. So thank you. I'm glad to be here.
Good afternoon, everybody, and certainly glad to be here. I was just scanning the audience, and there's so many people who I have had an opportunity, Matt, not unlike you, to work with in this space. And Michelle, in reflecting on the question, it made me look at even my own life, which for the most part has been about maximizing human potential. Whether it's been in the affordable housing space, this space, access to healthcare, it still gets down to, are we maximizing human potential? And I think one of the words that you're going to continue to hear a lot about today is that small word, access. In our work, where we see a lot of people every day, and we see people who have been marginalized for whatever reason, Matt, it is often outside of the food component, but it has to deal with lack of access. And so it basically now makes sure that we prioritize the need to make sure that we are bridge builders in developing our relationships and our resources to make sure that they are available for those folks, y'all, who will never get an opportunity to set foot in this room. If they are not maximized, then the community that we work in, which is Linden, will not be maximized. So that's why it's a priority on our end.
That's great. And we can stick with you, Adam. Can you share a little bit more about, from the faith perspective, how you have created a community of caring in the Linden neighborhood and beyond?
Yeah, happy to do that. For those of you that know our work, our mission statement is creating a connected community. And one of the reasons why we chose that is because as you look across the landscape in Linden, there are people who are doing some phenomenal work, but they are never in these rooms. The news media will never talk to them. They'll never see the light of day. And so we're in a position to breathe oxygen and resources behind the scenes into those organizations by virtue of connection. As we're doing, in fact, anybody who's worked with my organization probably has this wristband on. It says calling all connectors. And on the other side, it says, I see you. Our work is intentionally designed to make sure that we follow a very simple acronym called CARE, C-A-R-E. The C just simply stands for connect, meeting people where they are. Even as a faith-based organization, I'm trying to see if my brother Pastor Troy is in the room. He's not, but this is being taped, so I may get in a little trouble here. Even if you never come to Sunday school, if you never step foot inside of 2956 Cleveland Avenue, which is where our church is located, we want to simply meet you where you are to connect first. When we do that, we're in a position to then move to the A. The A is to simply affirm your humanity. Doesn't matter to us if you're blue collar, white collar, or no collar. Our job is to make sure that you feel valued in the space. That then moves us to the R, which you heard Matt talk about, which is relationships and resources. Most of those are like handlebars on a bike. You got to reach out to make them work. And so for people, again, who have been marginalized and not in this space, it's incumbent upon us to make sure our resources and relationships get pushed to the center of the table so they can have access to, which then moves us to the E. If they do that, then they are empowered to sit in the first chair of their own lives where hopefully they can begin to live by design and not default. So that's our model.
Thanks, Adam. And Dr. Roberts, we have social safety nets like SNAP and WIC. Can you talk more about what those programs do and how they could also be improved?
Yeah, so thank you. And you're right. We do have federal programs, SNAP and WIC, and I can speak from firsthand experience from WIC because that is a program that Columbus Public Health does run on behalf of Franklin County, on behalf of the state. We have the largest WIC program in the state of Ohio. Last year, we served 27,000 individuals here in Franklin County, and the need has increased. As Matt mentioned, since the pandemic, we have seen more individuals who need our services, but we've also seen a more diverse community who needs our services. And so that has slowed things down a little bit because we need to have interpreters there, but we're doing the best we can to process those individuals. WIC, for those who don't know, is Women, Infant, and Children. It's a nutrition supplemental program for pregnant women, postpartum women, and their babies. So children can be in WIC up to the age of 5. And not only do we provide WIC vouchers for them to buy food, but we also do a lot of education. We do a lot of screening to make sure the baby is growing and developing appropriately. And we do education around breastfeeding because we know breastfeeding can be very effective and a good way to nourish your child and can be financially beneficial as well. And we know a lot of individuals have trouble really embarking on that journey of breastfeeding, so we do provide that service. In addition to the WIC vouchers that we provide year-round, during the summer we also provide WIC vouchers for farmers markets, many of which we have and sponsor around the county. This past year, I believe this is the most recent data I have, we gave out 6,000 vouchers. And just so you understand what that meant in terms of dollars, that was $180,000 worth of produce, fruit and vegetables that we allowed our WIC, or we provided to our WIC participants. Again, that's huge. And I go back to when I started at the health department 18 years ago. We had just started the farmers market. We had 3 of them every summer right there on the grounds of the health department. And now we have multiple farmers markets that we help sponsor across the county. And so the number of WIC vouchers we give out for farmers markets has grown tremendously over the last 18 years and is continuing to grow. And as Adam mentioned, we try to meet people where they are. So we are not expecting everyone to come to us at 240 Parsons, but we are going to Whitehall. We are going to different townships, again, because we're providing this service throughout the county for all Franklin County residents. So it's a huge program. It is federally funded, and so we are at the mercy of the feds in terms of how much money they will give us. So I'm not asking any of you for money, but I am telling you that the budget is not growing with the population. And so we are doing the best we can with the resources that we have.
Thanks. So Matt, as you said, we're kind of not making progress. Things are more difficult now. I think the audience wants to know, what's it going to take to really solve this problem? Who is food insecure, and why has it been so hard for us to maintain progress, to make it and maintain it?
Well, it goes back to what I said earlier. I think, and one of the reasons we started to change our approach to all of this, I'm blessed to have both of these doctors on my board currently as well as previously, and to recognize that a whole food as health strategy was really paramount to everything that was going on. So everything we've done in the last several years, almost the last 15 years, is shift to a food as health strategy, having done diabetes research, a host of other things, and recognizing that what we learned in all of that, though, was in some research that we did trying to find out how many meals we were missing. And the research, I'll give you the simple answer, 145 million missing meals per year for the people below 200% of poverty in our 20-county area. Nobody's going to give a food bank but $1 a meal, 145 million more dollars every year, and that assumes your income doesn't go down and government support doesn't go down to solve this issue. So our simple solution was saying, look, at the end of the day, we're not going to food bank our way out of a hunger problem. We're there for the emergency care, and now we've really stepped into a food as health strategy, and I have a number of experts on our board that have helped us build out a strategy that says we can have health outcomes that are far better. I don't remember the latest numbers, but at one point for many of my years when I was on the WIC advisory board, for every dollar spent on WIC was about $3 in healthcare savings. I think it's a little lower than that now, but that's a huge savings in terms of what we're doing. So ultimately, if we're going to think about this, I tell everybody that now housing people love me because I champion housing more than I do food, and a recognition that says, if I told you you had to take 50 to 80% of your current budget and spend it on putting a roof over your head, you would be adjusting your budgets. Now imagine you don't have much money, and that's what's happening to you. So everything else trickles down from that. Daycare struggles in today's market. We all went through the wage increase and everybody paying more money. Daycare's got a cap, because if they keep raising wages of daycare and raising wages of daycare, guess what? They got to charge more, and then people can't afford the daycare. You don't pay your car payment, you lose it. You don't pay your utility bills, you're eventually going to have a problem. And the two variable parts of your budget are health care. You can take the pill every other day instead of what you're not supposed to do, but that could happen. And food. Food is ultimately the most variable part of your budget, and the hardest part in food is fresh food. So we shifted our entire business model to 65% fresh food now. It really is about how we get fresh food in front of people more often, and from the diabetes research we learned, if we do that with people and they get regular access, total different model. I have amazing partners in this room that have done this work for me, seeing Roy and Kathy for a very long time. But if we change the business model from come give you a 3-day supply of food and hope we never see you again, to come every week, get fresh food, learn about what you can do for your body, what it can do for things, and it's surplus food. There's 10 to 14 billion pounds of produce left in the fields not harvested every year in the United States. If we can capture that and have better health outcomes, ultimately save tax dollars, because of not having to spend as much on health care for people with chronic diseases, we can see a difference. But it starts with looking at the entire budget and the whole person and realizing that if these things aren't met, they're going to be at our doors, the wonderful 700 partners I have across 20 counties, asking for more help. So we've got to look at this in a holistic way, not just silo by silo by silo.
Thanks, Matt. And moving into the healthcare system, what role, Dr. Bradford, do medical professionals play in addressing hunger?
So we as medical professionals play a large role, not only in educating the future healthcare workforce with a community mindset to serve communities and to keep populations healthier, but I really want to talk about two examples of real life examples. What are we at The Ohio State University Wexner Medical Center doing today? So what Matt was talking about is called the Mid-Ohio Pharmacy. It's a play on words, FARMACY. And so our primary care doctors, this effort is led by our chair of family and community medicine, Dr. Aaron Clark. And so if we see in our primary care clinics a patient or a family that is food insecure, they get a prescription for fresh, healthy foods to go to our food pantry locations throughout our community and get healthy access to fresh, healthy fruits and vegetables. And so you might wonder, well, does that make a difference in their healthy outcomes? Yes, it does. It reduces the risk of diabetes, it reduces the risk of cardiovascular problems, it lowers blood pressure. And so ultimately that saves healthcare costs. It reduces chronic illness. So it's a fabulous program. It's very, very innovative and transformative, and it's leading to healthier lives, people who can thrive. Second example, and again, Near East Side, we have built a healthy community center because we feel very strongly we have an opportunity to serve and make a difference. And this, I give the analogy, it's like teaching people to fish. And so we've got a food kitchen. We can teach people to cook healthy meals. We can teach people how to do urban gardening to grow their own fresh fruits and vegetables. And I thank you for being here. I know you are part of that community, and I saw you at our grand opening in May. So we've got tremendous, we send our community healthcare coach for free healthcare, accessible to all 1 day a month. We talked about moms and babies. We have a program called Moms to Be. We also have a program called Dads to Be, and that's to help mothers and babies before the baby is born and after the baby is born have better outcomes for moms and babies, and we're getting the dads involved as well. So the leaders, it's Javante McDonald, an incredible community leader who directs the Healthy Community Center, and our amazing Joshua Joseph, an incredible physician scientist. He just talked at the White House about access to insulin at an affordable price. And we are doing the research that has already demonstrated access to healthy food improves health outcomes for entire communities. Thank you.
Thanks, Dr. Bradford. So we'll skip a little bit to policy. So during the pandemic, all children in K through 12 received universal free meals, so free school lunch. That program was essentially, the waivers were canceled after the COVID, pandemic had receded, but there are 8 states that have free universal school lunch now, and I'm curious whether the panelists feel that we should have free school lunch for all in terms of the conversations we talked about. Rising food insecurity for kids has a clear correlation to the fact that we don't have free school lunch, but wanted to hear your thoughts on that policy and maybe any others at the local, state, and federal level that would help us address food security.
Simple answer, again, not my area of expertise. I would say absolutely yes, and figure out how to also provide a healthy lunch over the summertime months when the kids are not in school.
I would just echo what Dr. Bradford says. A child should not be at school hungry. If we are providing food, we should be providing food for all children, no matter what the eligibility is. Children cannot learn if they are hungry. You, as an adult, have trouble concentrating when you are hungry. Imagine being 9 years old and being hungry and being taught a valuable class lesson but not being able to focus because you're hungry, to no fault of your own. So we have to do better as a community and as a society to make sure our children are fed year-round.
I would just add to that, it's absolute. The reality of it is the busiest time of the year for food banking is the summertime. It's when you don't have 2 meals a day going to kids, that they're taking it. So the answer is we got to do this, and it doesn't make any sense not to do it. The other piece of that is the current models create a lot of stigma around eating. And you're dealing with grade schoolers and middle schoolers and high schoolers, and stigma is a big issue. So if you make that go away and everybody just sees, hey, this is just good nutrition so I can learn, it's a whole different way of thinking about it. I was in Minnesota recently, and I was at their state fair, and the Second Harvest Food Bank of Heartland was there, and they have the bag they give out to you to carry stuff around in. It said, hunger is a policy choice. And that's the reality.
So I would just offer, on a macro level, at some point in time, it just makes good governance sense, whether the policy is 5 years old, 10 years old, 15 years old, to go back and reevaluate it in connection to the intersectionality of policy, people, and product, and profit. We don't often do that. Matt is right. We typically look at this issue in silos. But when you begin to look at the intersectionality of those four things, you will make some changes with respect to policy, because what may have been appropriate a decade ago may not be appropriate now. And so sometimes I just think we have to urge people to get around the table and be bold enough to say, is this still a good policy?
Great. Okay, so free school lunch for all. You heard it here. If you agree, we're going to get that done. Check. All right. I was hoping you would say that. And then just going into a little bit more about the intersectionality of the issues that we're dealing with. Any other solutions or place-based work that anyone wants to lift up around how we incorporate food in housing, in healthcare, in education? What else comes to mind, and/or what are you hopeful about?
I'm going to go real quick with one that I think we lost. I mean, one of the things we saw during the pandemic, when the subsidies were going out, the child tax credit was there, you know, that poverty rates were going down. They were dropping. Mm-hmm. And we decided that was just a COVID solution versus, why don't we just do it? We lost that child tax credit by 1 vote in the Senate, you know. And I also happen to be a Democrat at the end, but I blame all the Republicans who didn't vote for it. That's my politics. But the reality of it is we saw the path forward and we stopped doing it. The reality, give people money to make their own decisions, and 99.9% of the time, they make good decisions. You know, let them go to, you know, our strategy is, I want you going to the grocery store to get your food. You know, and how do we help make that happen as opposed to having to come to a food pantry? So for us, we've got to get back to challenging to say, we had good policies, they were working, and let's continue them so that we can move people out of poverty. If you want to end hunger, you got to end poverty. You want to end poverty, you got to end racism. It's that simple. Not easy to do, but that's really what has to happen.
Well, and I will say this, and I'm sure some of my staff who are here are going to be like, oh, I can't believe she said that in public. But to Matt's point, I mean, we should have universal basic income. People should be able to have income and use it to fit their needs. So
I wanted to also advocate, I mean, I do think, how do we address social determinants of health, and how do we really make strides in ending poverty? And of course, as the dean of the College of Medicine, I'm a pretty big advocate for education. So you give people healthy, nutritious meals and shelter and access to high quality, affordable education, K through 12 and beyond. Pre-K is fine. And there are so many really meaningful positions. By the way, there's a huge healthcare workforce shortage, so there are so many amazing roles for people to play in our community. So I just think that giving people the opportunity to thrive and no longer live in poverty, and I do think education is an incredibly important opportunity for us once we have nutritious, healthy meals.
Great, so we got some great policy ideas here. Now it's CMC's long-standing tradition to take audience questions. We'll move to the questions from our live stream and in-person audiences in just a few minutes. So if you have a question, please make your way over to the microphone now. And if you're joining us online, please feel free to type your questions into the chat. But before we take audience questions, I'm going to ask the panelists one more question, and we'll just return back to our central theme, which is, what would it take to end hunger in Central Ohio, and how can our community work together to get there?
I'll start. Michelle, you reminded me that we did a panel similar to this 9 years ago. Mm-hmm. And here we are, fast forward 9 years later, post-pandemic. And we're still talking about this, right? And in many ways, the issue has gotten worse. But as a community, we've rallied together and we have more resources, but the need has outgrown those resources. And so I think we need to start thinking about the need. And a lot of that comes with income. And, you know, what are we doing? What more can we do to make sure that people get a living wage so they can provide for their family? And then I go back to my comment earlier about a policy issue around universal basic income. Everyone in our community should have enough money in their bank accounts to take care of their basic needs and not have to pinch and cut things out that they need. So making sure they have a roof over their head, making sure they have some form of transportation to get to where they need to go, making sure they have enough resources to buy food to provide for their family, to keep the lights on, and to go to the doctor's appointment so that they can remain healthy.
So I think I completely agree. Thank you, Dr. Roberts. I would add that it takes all of us. Everybody in this room and everybody online, it takes all of us to do something. You know, I have been a Columbus member of this community for 4 years, and I'm so impressed by what we can accomplish as a community when we work together. And we actually already do a lot, but everybody who's here, everybody online, this entire community needs to come together and partner together and work together to address food insecurity, housing, access to health care, and opportunities for education.
Just to add one other totally different point to this, how do we use technology to do things differently? You know, so we're in the process in this community of building out a community information exchange. We're gonna need all the marketing people to help us name that, because CIE doesn't roll off your tongue very easily, and people go, what? But it's really about how we can build a connected system using data. We have these amazing care workers, navigators, social workers, you name them, everybody's got them, and none of them get to talk to each other. None of them see the resources together. So can we build a collaborative tool that allows a customer, as I call the people that show up to get food from us across our network, the ability to navigate it themselves if they want to. You know, right now you've got to enter through some social service system to get into anybody's database. But being able to navigate at that level, building a collaborative so we can see what the people's challenges are across all of those silos and come together, and then ultimately have population outcome data that allows people to make better decisions with the limited resources we have, how to be far more targeted. So we're in the process of building that. It's been funded with ARPA dollars so far, with the city and the county, you know, coming together. You know, we've already done test cases of looking when people show up for the first time at a food pantry to when they end up homeless. And can we step way upstream and solve it up here instead of the journey down to the treatment model of being evicted and homeless? So it's an opportunity to do things differently, use technology. We can solve for the privacy issues. We can solve for the HIPAA issues. We can solve for the school issues with data. Those are all solvable. It's being done in other cities. We're learning from them, and we're trying to build a model here. So if you hear that term, that's what it is, and it's about how we can do things far more effectively and efficiently today, because I'm concerned the Human Service Network is struggling right now with resources in a big way, big, small, and it's a big issue. And what happens if that fails? It'll be a death by 1,000 cuts, but what happens to the whole fabric of our system if we don't start to come up with new ways of addressing issues?
Right.
If I might, Matt Habish, he won't admit it, but he's been the sort of protagonist you always want in the room. And the reason behind that is because he will always put the relevant question on the table and the relevant challenge. I simply did not want to blow past his comment that in reality, if you want to end hunger, you have to deal with poverty. And if you're going to deal with poverty, you cannot be afraid to sit down and have a conversation about racism. And so while we're talking about things at a very big level, at the micro level, when you leave here today, I would just encourage everybody to use the formula that we use. When you are encountering people on the street or in your workplace, right? Seek to connect first, then affirm their humanity. Again, no matter if they're white collar, blue collar, no collar, right? Then bring your relationships and resources to the table so that everybody has the benefit of that. And continue to move people towards what we call empowerment and equity so that people can make decisions by design and not default. Everybody can do that the moment you step out this door.
That's great. Seek the connect. And now Doug's going to take questions from the audience here in person.
Michelle, thank you so much, and thank you to today's panelists for a great conversation. If you have a question for today's panelists, please do join us here at the microphone. If you're watching online, please type your question into the chat. We'll try to get to as many questions today as we can. Great questions at CMC always follow two important rules. They take 30 seconds or less to ask. And what punctuation mark do they end in? A question mark. That is correct. Thank you. I'll launch us off with this one. It came up before, but can you speak more about the role of learning to prepare fresh food at home, to cook, in combating hunger?
I'll jump in. One of the things that we do, we manage two pantry types of entities in Linden. We have our Bread of Life food pantry, which sees about 200 or so persons or families a month. We also manage now the Fresh Market, which was actually stood up by another faith-based entity from the South Side, my friend Reverend Edgar. That market started out seeing about 125 people a day just 2 years ago. Robert Cardwell is in the audience. We now see in excess of 400 people a day. Is that correct? It's absolutely mind-boggling the amount of people who come through there. And so what we're able to do in both of those settings, particularly over at the Fresh Market, which is all fresh produce, is that we do cooking demonstrations on site. So when people come there, they can dwell. If you're there on a Wednesday and you see Robert, he's probably doing what we call Wobble Wednesday. So we bring our culture to the marketplace. But it's in that setting that people in real time are allowed to get in and see how they can cook and take those products and produce home and do the same thing.
Real quick technology add to that. We just, last week and the weekend before, did a hackathon using AI and said, can we build nutrition rails on what we call HER, it's healthy eating for us, and let you ask any question, any menu item you want to know. I need a recipe for this, I need nutrition, I need a medically tailored meal for diabetes, because we were all trying to bust, we were the beta testers. So we're using technology to build so that people can do that right at their own. I don't know what to do with a rutabaga is what I hear all the time when people get off. Well, none of us know what to do with a rutabaga, let's be honest. So the reality of it is we can use technology to help people right on the spot and say it could be a nutrition question, it could be a health question. We're trying to build it all in such a way, but it could be very specific about recipes and how to do things, with the food that you have in your house, accessing. We're really concerned. You give people a bunch of fresh produce. Who in this room goes home every night and makes a meal from scratch every single day of the week? There's always one. My nutritionist at the food bank said she does too. But nobody, most of us have choices. So why are we giving a bunch of people that were struggling, mostly single parents in a lot of cases, to be able to do that? So how do we help make it easy, convenient to make a healthy choice with food? And that's the challenge that we're trying to live into. And I can tell you that operation that we started together, that Fresh Market, is now in our top 10 of distributions in the entire 20 counties.
Good afternoon, and thank you very much to the panel, but also I want to give special thanks to Susan and the team at Osteopathic Heritage Foundation for having us as her guests present today. We are grantees, and I think it's very important for us to be in the room and share this occasion, because part of the discussion around the social determinants of health, and you spoke but moved around, it's employment. If we can't create for ourselves, it's very difficult to provide all the other, or to be able to address the other elements of the social determinants of health. And so we come from urban agriculture. It is more than backyard growing. It is more than community gardening. It is moving people from passion to profit, and doing it in a disciplined way, and understanding that urban agriculture can be a recourse. So one question is, what are you doing to facilitate this process? Question 2 speaks to, again, that pipeline. Education is important. Agriculture is not considered a viable option for the Columbus City school system, although you can have school gardens, but you can't necessarily teach it as a curriculum. So what do we do to change that to encourage the development, again, of access to the 20 different occupations or careers that are offered, for instance, by Ohio State. And then finally, you spoke about WIC at one end of the demographic, but I didn't actually hear anyone address the role of seniors. And we have a real issue around health and access to food in our senior population. I'm also working with Local Matters and the community advocates, and we've been critiquing the emergency management plans for Columbus and Franklin County. And the first thing almost all the plans say is stockpile 3 days worth of food. What are we doing to help our seniors combat the health issues? Thank you.
So thank you, great, and thank you for your incredible work on urban agriculture, and it would be great to partner with you and your team to enable all the work we're already doing. So, you know, how do you, I'll try to tackle, how do we bring agriculture into high school, elementary, and middle school education? I would say I'm the Dean of the College of Medicine, but I have a fabulous colleague who's the Dean of the CFAS, Food, Agriculture, and Environmental Sciences. And I think that we should partner together and to bring that curriculum to our high schools, to our middle schools, to our elementary schools, because it is a career choice. By the way, most of the state of Ohio is actually rural, and there are fabulous ways to improve the efficiency and the cost to generate, again, healthy food choices. So I think it's a wonderful, wonderful question, and thanks for all the work you are doing.
Just give you real quick answers. We just opened last week the Mid-Ohio Farm on the Hilltop, which is a really high-tech teaching center. It's really what it is, in partnership with Ohio State, Ag School, Extension, you know, Franklin Park Conservatory, who's been a wonderful leader in this community around urban gardening for years. So it's a real opportunity to teach. You know, Nationwide's Training Center hosted the USDA BIPOC conference. So this is east of the Mississippi, mainly African-American farmers coming in and learning. We happened to host them for lunch at our farm, then they went to other sites. But it's a great opportunity, and the most exciting part about that was little kids, 10-year-old boy, pummeling our farm manager with great, I mean, very sophisticated, great questions. So it was a real big learning, but we hosted that right here in Central Ohio. I don't think most people knew they were even here. But it was a great opportunity to do that. To your question about seniors, there's a program federally, like acronyms, CFSP, Commodity Supplemental Food Program. We have about 5,000 food boxes that go out every month, so we can help people do some stockpiling in terms of food. But it really is an opportunity to connect to our seniors. We also do mobile pantry drops, produce drops at senior sites, so they can come out and they get to do a farmer's market right outside, you know, their doors and get to shop and pick up fresh food.
Yeah, and I would just echo some of that. There is SNAP that is available. And then we do have the local food action plan, which is looking at access as well as urban gardens, as you're aware of. But we do have more work to do, and I think we've all acknowledged that here.
Two things. Real quick, with respect to education and employment. Landon Adams is in the room someplace. Raise your hand, Chief. Landon oversees our farmers market, and he also oversees what we are now launching called the New Salem Gardens. We own a little bit of land behind our missions house where our food pantry is. We have some land to work with, and so because we see a fair amount of young people every Wednesday, in fact, we see a lot of young people on Wednesdays. And so they are able to come, get their hands in the dirt, sit and listen to some of our people who do that sort of work. They can come right back to the church on the fourth Wednesday of every month, where we have resources and resource people who are connected to employment. So the idea is we use food as a mechanism to attract, but it's also an opportunity to bring people into a space where they can move to that next level. And I could not agree with you more. If people have a living wage and employment, it solves a lot of this.
Thank you. Carol Looper, watching on the live stream, asks, how do you find the people who need you the most? What communities do you go into?
Well, I can tell you we've been doing data mining and data collecting for now 13 years. We lead the country in terms of really looking at where people are, and we're able to do that but from all the amazing partners who partner with us with a data system to capture who's getting help where. We can take that data then and look at that against GIS data systems to see where 200% of poverty are, clear down to the block track inside the census track. And we discover where we think the numbers are gaps and then start to look to see if there are people living in those communities that are not accessing us. So do we then target? We very specific. We have 1,200 free produce markets here. We start targeting neighborhoods where we don't necessarily have a food pantry reach. And I'll give you a really good example right now. 32 zip code, southeast side, think Eastland Mall. You know, we were fortunate enough to acquire a facility out there. We now own an entire old plaza, you know, and are in the process of starting to rehab that plaza to really build a holistic approach. There are very few, if only one, Center for New Directions has a facility out there. This was the old Mayor Coleman and I, before he was mayor, used to talk about Northland, Eastland, and Westland, the middle ring. It's where suburbs started, and social services were not in those particular spaces. So we've got Norton Road with the market on the west side with a lot of help from the Osteo Foundation, you know, and we're working on the Northland community. We have great partners up there. And Eastland was the area where there are none. And so the idea of building a wraparound service, getting healthcare, WICs, you know, going on the journey with us, a Mid-Ohio market, other services for that area. To your point, your question about jobs, can we get workforce development? So it's a one-stop shop, even negotiating with CODA about putting the bus, you know, big transit center right on the property. So it's a unique opportunity to say, we got a big gap. They're driving clear to Grove City to get food. That does not make a whole lot of sense. So we've got to do better. So for us, we can able to use data to pinpoint where we need to be.
I would simply offer in response to that. I think we often ask that question in terms of where do we find people. I think the question we should be asking is where are people already at, right? Because people do gather. And we have the benefit, as most faith-based institutions, we don't have to send out a notice, a press conference, anything else. We see 2,000 plus people every Sunday. And so the goal that we try to share with our partners, just show up, whether you're hanging out with us on Sunday or whether you're hanging out with us on Wednesday. I just shared with you, the Fresh Market sees 400 people a day. You're not going to get any deeper penetration inside of Linden than that. So oftentimes we try to do special programs. Just go where the people are and be there in the mix and be there before, as we like to say, day one. Establish the relationship so people get to know you. So I would simply say find out where people are already going.
Just echo that. That's what we do at Columbus Public Health. We have staff of several dozen social workers who are out in the community on a regular basis, finding people who need resources, whether it's food, whether it's housing. And then we always have a phone line where people can call in and tell us what they need, and we can help connect them to the appropriate services. So that's where we find people.
I would also add, as we find people, meet people where they are, I would also add it's really co-creating solutions with the community directly. And so it's not us saying this is what we're going to do, but how do you work and partner with the community to co-create solutions together?
One thing I would add to all that, if anybody in here somebody says they need help, the fastest way to do it is tell them to go to freshtrack.com. There's no C in track. Put that in, put your zip code in. It will tell you exactly where the pantries are in your community, when they're open, who's open right now, who may be closer to you that's open tomorrow if that works. So that data is all that we've worked really hard with our partners to keep that data up to date so the people know it can stay right in their own community when there are solutions in your community to be able to avail them. We've got amazing partners scattered throughout our entire community except for the 32 zip code, and it's an opportunity to make it easy. So it's the simplest thing to remember. If they need help, tell them freshtrack.com, and it will immediately put their zip code in, and it'll get them connected.
We have 3 minutes left for two final quick questions.
Okay, I'll make my question quick. I'm Rob Moore with Scioto Analysis, and I had a question about some of the topics that you've brought up today. I may say most of the solutions that we've talked about today have been things that can be dealt with at the federal or state level. For instance, the child tax credit, school lunches, the SNAP program and eligibility. So I'm curious about what kind of policy solutions that you would recommend at the local level. If you had a mayor or a city council member or a county commissioner who came to you and said, I want to make hunger my #1 issue, and I want to have one policy position that I want to put forth in and champion, what would you recommend to that policymaker?
Basic income.
Cities that have done that. So it's not just that at the federal level. There are cities across the country that have experimented with that. So I would, clearly you got to raise income. At the end of the day, we've got to be able to have wage conversations. We've got to be able to create. You want to move people out of poverty, the only measure of success is income. That's what you're measuring, income/household size. But the other issue that I think they're starting to address is housing, the zoning code. Something I struggled with for 14 years on city council was our old zoning code. And the new zoning code, we've got to encourage density, building houses, figure out ways to get the price points of housing down so that people can afford it.
That's another space for you guys supposed to clap.
Hi, I'm Laura Fish with Applegate Talent Strategies, and we opened this conversation with the fact that 55% of those who are food insecure don't qualify for SNAP because their income exceeds that amount of money, yet they are still food insecure. And the wage that you mentioned was really a living wage that these people are earning. So my question is, what solutions have been, exist or we do have experience seeing where businesses are able to support that food insecurity for their own employees? They're working somewhere.
You want me to take that? Well, one thing is Letha Pugh, who is running a bunch of different programs, Service Org being one of them, is really taking care of hospitality workers in particular. And just to clarify on the note I gave earlier, so $40,000 for a family of 4 is not sustainable in our community. It's about over $60,000 in Columbus to support a family of 4. So between your rent and childcare, et cetera, and then if anything happens in healthcare, so that's not happening. But I think that employers, I think particularly in the hospitality industry and some others are coming up with some innovation that we can look at to make sure that the people who work with us in the nonprofit sector too, where wages are not that high, make sure that we can bring it up and that our funders say, okay, you need to pay at least $20 an hour. We're going to make sure that we're supporting you in doing that. So that would help us as well. And we are out of time, as Doug is sharing with me. So I am so grateful to all of you for joining us today, and I'm going to turn it over to Kristen Rost from Nationwide.
Thank you. So thank you to today's forum sponsors, the Jeffrey Family Legacy Fund, Kroger, the Osteopathic Heritage Foundation, and Nationwide, and today's forum partner, the Ellis. We are also grateful to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch. And a very special appreciation to today's panelists, Carol Bradford, Matt Habash, Makisha Roberts, and Adam Troy, and our wonderful host, Michelle Brown. Your personal insights and dedication to tackling food insecurity have been eye-opening and inspiring to all of us. The reality is that far too many people in our community face uncertainty about their next meal. And while the challenges are daunting, they are not beyond our ability to overcome, as we've heard. Today, we have heard about the incredible work being done to not just provide food, but to offer hope and dignity to those in need. As we mark Hunger Action Month, let's remember that ending hunger in Central Ohio requires a collective effort. Together, we can ensure that every person in Central Ohio has access to the nutritious food they need to lead a healthy, productive life. And now, before we end, please register to join us next week right here at the Ellis for our next forum, Open Every Door, Transforming Workforce Development in Central Ohio. Thank you again to everyone who has joined us both here in person and online. We couldn't have done it without you. I hope we all leave here today with a renewed determination to act. Have a great afternoon.